Good morning, everyone, and welcome to GHC's final pre-rolled health assembly webinar. Today, we're going to be focusing on some intelligence or some intel from the U.S. delegation. Next slide. For those that don't or haven't been attending the other webinars in this series, just wanted to mention a little bit about Global Health Council. GHC is the leading membership organization supporting and connecting advocates, implementers, and stakeholders around global health priorities worldwide. We represent the collaborative voice of the community on key issues. We convene stakeholders around key priorities and actively engage with decision makers to influence policy. I wanted to thank everyone for attending our series so far. And I also wanted to note that all webinar recordings and PowerPoint presentations can be found on our website. I've included the link here. So we have a page with all of that information if you'd like to review the previous webinars that we've had so far in this series. So before I pass the mic, I just wanted to go over a few details about the upcoming 72nd World Health Assembly. WHA will open on Monday, May 20th at 9:30 a.m. With opening remarks from Dr. Tedros in the afternoon. And then the assembly will close the following Tuesday on May 28th. And I know many of you on the call are going to be attending for probably the first half of the week when a lot of the side events and proceedings take place on the grounds of the Palais and then also in the surrounding area as well. Next slide. I did want to remind everyone that documents and the full agenda for WHA can be found online on WHO's WHA 72 page. The preliminary journal was released last week on May 2nd, and that does include not only the agenda items in the schedule, but also some technical briefings that will be going on, again, on the grounds of the Palais. So I do encourage you to review that site. Also a note on the right-hand sidebar, you can find statements from both member states and non-state actors in official relations with WHO. Next slide. So like I said, technical briefings can be found in that preliminary journal. There's also member state meetings hosted throughout the week on the grounds of the Palais, and that schedule is now up. And then in addition to that, there's also non-state actor side events. And these are shorter 50-minute sessions that are hosted Tuesday through the following Monday evening. And again, all these links will take you to those schedules. And now just a few very brief notes about GHC's delegation. We have nearly 100 delegates joining us from 19 countries, representing about 39 of GHC's member organizations. We also have 16 delegates from lower middle income countries. We are bringing 5 patient champions this year, and our delegation is comprised of 67 female delegates. We will be hosting, or GHC will be hosting a couple larger public events that we do encourage you to attend if you're able to. The first one will take place on Monday, May 20th from 3:30 to 5:15 p.m. And that's going to be on community and civil society engagement for the Global Action Plan on SDG 3. And then following the program, we will actually have a GHC member reception from 5:15 to 6. So we do encourage you to stay and mix and mingle with fellow GHC delegates and advocates. The following day, we will have a UHC town hall, again in the afternoon, also hosted at the Geneva Press Club, with a number of partners supporting us on that event, which will lead actually into the official side event on UHC that is organized by the Save the Children and co-hosted by GHC. So we encourage you to attend both of those events. And just a note on our first 2 events, they will be live streamed. And for those that are attending on site, we'll be providing French interpretation. So again, those RSVP links are noted on the screen, and they can also be found on our website as well. And then finally, a note on GHC's statement on WHO reform, which we've opened up for comments from our GHC members and delegates. We have sent out some information already on this, but if you would like to provide some comments to be incorporated in the final statement, we do encourage you to fill out that survey. It is due today, so if you do have a few minutes, perhaps after this webinar, we would love to get your feedback on that. Oh, and sorry, final note. We are hosting a side events calendar on our website. So if you or your organization is hosting a side event throughout the week, please share that invitation with us so that we can circulate it on our website and then also on our listserv as well. And with that, I'm going to pass it over to my colleague, Danielle.
Thanks, Liz, and thank you again, everyone, for joining us this morning. We're very excited to have Colin McIff from the U.S. Department of Health and Human Services and within the Office of Global Affairs join us today to provide some insight into the U.S. delegation and what they're anticipating to be their priorities at the upcoming WHA. Just a quick background on Colin. He, as I mentioned, he's currently the Deputy Director of the Office of Global Affairs at HHS. He has served in a number of roles, including from 2016 to 2018, he was the Director of the Europe Office of FDA and the HHS representative to the EU. And prior to that, and I'm sure many of you may have known him in this capacity, he did serve as the health attaché at the US mission to the UN in Geneva. And if you'd like to see his full bio, it is available on the HHS website. And with that, I'm going to turn it over to you, Colin.
Thanks. Thanks very much, and good morning, everyone. I'm really happy to have the chance to be here with you and to talk about WHA and this upcoming meeting. This year we're very happy, as last year, to be led by Secretary Azar, and we'll have a full complement of a U.S. delegation as we have in the past years with representatives from all around HHS, from the Department of State, from Agriculture, Commerce, USAID, and USTR. Along with the Secretary, we have Dr. Redfield from CDC joining the delegation. Assistant Secretary for Health, Brett Giroir, will be with us, and Deputy Commissioner of FDA, Anna Abram, will also be joining. So that's some of our kind of senior officials that'll be on the delegation, and happy to also talk about our priorities. I know UHC is a major priority and a major theme for the Global Health Council, and that's actually wonderful, to hear. It's definitely a major priority for us as well, and definitely I would say one of our top 4 or 5 priorities for the Assembly this year. And maybe we can talk about UHC more in detail and how the U.S. position is evolving on that. Other issues that we're really tracking and focusing on, of course, the ongoing and in fact worsening outbreak of Ebola in the Eastern Democratic Republic of Congo is a major priority. We're looking forward to some deep dive sessions with the DG and his leadership team, with the DRC representatives as well, to see what we can do as the U.S. and as the different parts of the USG to support and to just do everything we possibly can to get that outbreak turned around and under control. I think another major priority for us is going to be on women's, children's, and adolescent health. There's a report on the progress of the overall strategy on women's, children, and adolescent health that is on the agenda this time as a result of the Africa Group proposing it back in January at the board. And we'll be participating there with a number of member states. As folks know, this administration has very particular views on that, on aspects of that, and in particular just being clear on the abortion issue, and that's the way it is. But I think there are a lot of aspects of beyond that one aspect of the issue that the U.S. government is still heavily involved in through USAID, through CDC, and through our overseas programs. So we're hoping to work with like-minded countries to find some positive ways to engage on women's, children, and adolescent health at this assembly. Then another major area of interest for us is the access to medicines set of issues. There's the Access to Medicines Roadmap, of course, which is due to be sort of noted and taken forward by the Secretariat. And then perhaps maybe a little bit more interestingly, I think it's getting more attention, at least right now, this proposal, which folks probably have seen if you're following these issues, from Italy on transparency in pricing. And of course, the announcements this week about the requirements for here in the States for medical product advertising to include list prices. That new regulation was announced this week. So this issue of price transparency in particular is a major priority for this administration. And so we look forward to working with Italy and the other countries to develop a resolution that can complement at the global level what we're trying to do domestically and nationally here. So that's another set of issues. And then lastly, and I appreciate that you all are also tracking this very much and try to encourage it in positive ways. I would just note the Director General's transformation agenda and of course the program budget that goes along with that, but just the ongoing reorganization of the organization and his big push for the really significant culture shifts that need to occur in WHO for it to be really the effective and nimble organization that we all need it to be. We're very supportive of that. We also have a lot of questions about that, and that'll be another priority for us at this assembly. And maybe I'll stop there. So that's just a quick snapshot of sort of who's coming from the USG, USDEL, and some of our top priority issues.
Great, thank you, Colin. I'm going to take prerogative as facilitator to ask a couple questions first before we open it up to those on the chat. If you do have a question, please do type it in the chat box, which you can see in the control panel up on your screen, and I will read out questions as we go along. But my first question for you, Colin, is to talk a little bit about the UHC process. As we all know that there is the UHC high-level meeting later this year at the UN General Assembly, but also this, as you mentioned, is a big topic at WHA. And I wanted to see from you if you understand a little bit how the process at WHA around the UHC, the discussion, the resolution that will come out of it, will feed into the discussion later this year.
Yep, no, happy to address that. So, I mean, as folks know, well, very, very well, like none of us can escape it if you're an American. Our domestic debate on healthcare continues, and how healthcare should be handled in our country, what it means, how do you achieve key concepts like value-based care, those kind of issues. And that has taken some time for, I think, this administration to sort of wrap its arms around the concepts of UHC at the global level, what that means for as part of the Sustainable Development Goals, for what it means for global health policy and for programs. But I'm happy to say, as someone who's been working on these issues and did work on those issues, as you pointed out, from Geneva when the SDGs were finalized, that I think we're in a very good place with respect to the UHC discussion. Broadly speaking, we're quite supportive of the resolution that was agreed in January at the Executive Board and forwarded to the Assembly, and that we hope will be approved with no further changes at this Assembly as a kind of almost hopefully a rough draft for the negotiators in New York to consider for what the political outcome could look like, at least hopefully some inspiration. And for us, there are some key concepts in that resolution in January that are worth maybe flagging for the group. One, for us, as you can imagine, it's critical that any declaration or discussion of UHC makes it clear that that it's each government's responsibility and each country's responsibility to kind of find its own path to universal health coverage, that there's not any kind of one-size-fits-all government-centric approach to service delivery and to healthcare that folks can point to, that the WHO can point to and say, this is the blueprint, this is what you should do. There certainly are the basic basket of services coupled with the basic financial risk protection, that basic definition of UHC that's kind of there in Target 3.8, along with the access to medicines I point out. That's something that we very much can get along with, and the importance of primary health care as the sort of foundation of that is something that we can get on board with, and we've been very supportive, for example, of the PHC conversations, including last fall in Astana with the declaration there on primary health care, and we've joined with Kazakhstan as one of the champions for PHC group, and so I think that's a key issue for us. Another aspect of UHC that's critical, that's in the resolution that's at the Assembly, is a recognition that that this is a goal, a policy goal that we all can work toward. It is achievable. Obviously, a number of countries have achieved it by the UN definition, but it's something that one works toward. It's not something you instantly have or don't have, and so that's another kind of key policy dimension for us. And then lastly, I would just note, along with what I said earlier about the no one-size-fits-all approach, we seek to emphasize the valuable role that the private sector, that civil society organizations, including faith-based organizations, can play in service, and do play in service delivery and in providing that health care around the world, in countries around the world, including, of course, in the States. So that's really our approach to UHC, and we'll be seeking to reinforce those messages. One area of conflict, I guess, especially between ourselves and primarily the EU, but a number of other countries as well, is around the sexual and reproductive health issues that I alluded to earlier. There is one paragraph in the resolution on UHC that calls for, using the language of Target 3.7, calls for sexual reproductive health to be included as part of the UHC, and the U.S. will be disassociating from that paragraph. This is why we hope to have to try to change a little bit the terms of the debate and to see if we can talk about other aspects of women, children, and adolescent health in maybe more effective ways, in more consensus-based ways, given the policy positions are what they are for ourselves and others. So, but big picture, that's where we're going with UHC, and we're supportive of it as of now, anyway. The plan is for Secretary Azar to head our delegation to the UNGA in the fall as well, and so I think that's a demonstration of our commitment to working together with the international community to tackle these issues and to continue to be sort of positively engaged in the debate. We do believe that the USG, through our different programs, whether that's the work that CDC does or USAID or even FDA and NIH, we think that work is very meaningfully contributing to UHC around the world, and so we do want to engage, and we're appreciative that we've been able to get the framing language elements in the way that we need them to be able to engage. And I'll stop there.
Great, thank you. I had one more question along WH reform. Obviously, a lot of people on this webinar have been following that as well. I wanted to focus on the non-state actor engagement part of that reform. I know there's been a number of proposals proposals put forward about perhaps convening non-state actors prior to official proceedings of WHA, and just wanted to see if the U.S. has given some thought to some of these proposals, including making documentation available earlier for us to make comments, allowing us to comment earlier so that it can be more meaningfully incorporated into your proceedings as you discuss various resolutions.
Yeah, I mean, I would say the U.S. is very open to any creative solution that increases the involvement of non-state actors, all sets of non-state actors into the WHO proceedings. Of course, we totally get that for the policy development, that the member state negotiations, I mean, just the nature of them, they do often usually need to be closed so that member states can really have that space to work out their differences. Similarly, in the guidance development process, those expert working group processes need to have their firewalls in place to make sure that undue influence doesn't take place. But WHO has those procedures in place, and I think they're working basically well. Beyond that, there's as someone who's been around the UN system and different parts of the UN system for most of my career, it is remarkable given how important civil society and all non-state actors are to global health and to kind of local health. It's really remarkable how little there is opportunity for that engagement. So we're very open to any of those creative solutions that you just said, for example, Danielle. So we're happy to work and figure out what can be done. Unfortunately, every time we get into this discussion of governance reform, then the member states take it on, and obviously, since we are I think we are maybe the main problem with governance reform. It's not good if we need to find a better way to get some of these conversations going and to try things out, so that people can get over their fear of losing influence, losing effectiveness, whatever it is that's causing people to resist these kind of changes. And we're open to that dialogue, very much so.
Well, great. Thank you. I'm now going to turn to questions from our participants. As I mentioned, I will read them off from the chat box. We do have a question around activities on AMR and the EB resolution that had focused on the follow-up from the high-level meeting on AMR.
Oh, sorry.
And there wasn't a specific question on that. It was just more wanting to hear more information. Sorry.
Okay, about AMR. Okay, sorry. Okay. Yes. So, so this is I guess the only reason basically I didn't mention that as one of our top issues in my sort of opening discussion of our kind of top issues that we're tracking is because it was a very successful executive board with the resolution that we led. As folks know, that was the first resolution led by the U.S. under the Trump administration, and we ended up with more than 40 co-sponsors. So we were very pleased with that from all 6 WHO regions. So we're happy that there is a renewed interest in that, and we're also very gratified in the in the transformation announcement. Dr. Balki being from Saudi Arabia, being elevated from she was, I guess, an ICG member and is now the new ADG for AMR within WHO. That we think that is an excellent move. She is going to do a great job, and we are really looking forward to working with her. So I think what we hope will happen at the Assembly on AMR is that we'll adopt that resolution and have some other discussions. We are working with the WHO team and with other key leaders on AMR, like Netherlands, Zambia, Sweden, to have some side meetings to discuss sort of both where we take those ICG recommendations from a practical standpoint. I mean, we were very happy to see that when you look at the governance portion of the ICG recommendations when they finally came out, a big push was on strengthening the tripartite relationship between WHO, FAO, and OIE, and that for us remains the core thing that needs to happen. And that means that those three agencies have to step up and be more transparent and inclusive in the way that they do their work together, including with member states and I would say with non-state actors. But it also means we as governments and other actors who are involved in AMR need to step up and support them as well. So we're looking very much to see how we can do that. What we don't want to happen as the U.S. from the ICG recommendations, and we think that that's largely been avoided, but we still need to stay vigilant and stay engaged. We don't want new sort of alternate power centers to be formed either in New York or any place else to the tripartite group that really needs to drive this forward from a human, animal, and environmental health perspective. And so we're happy that there will be New York engagement and that there has been the engagement of like the Deputy Secretary General and others. That's gratifying as well. But we don't want the focus to shift to New York other than maybe as a coordinating role. We want the focus to stay with the three agencies that are primarily responsible for those issues at the global level.
Great, thank you. There are several questions on the topic of access to medicine, specifically focused on the U.S. position on access to medicine, as well as the U.S. government's role or other major projects in this area.
Okay. So just, I mean, maybe to recap, and folks, if they want to get more specific, I think we're, I guess, in the biggest possible sense, there's this access to medicines roadmap, right, which is really almost like a compendium of past mandates or ongoing mandates and what WHO is doing with them. You know, we do have some, I guess, to be honest, I guess some continuing questions about that. But broadly speaking, we're appreciative of how responsive WHO has been to our questions throughout the process, and we're also respectful of the other countries' views of not wanting to reopen or relitigate past mandates either in this case. So I think what I would expect will happen, and to be honest, as I should have started off with, you know, USG positions, formal positions are still being finalized. So some things might, your mileage may vary on any of my answers here this morning. But what I would anticipate you'll hear from us at the Assembly on the roadmap specifically is, again, appreciation for the work that's gone into it, willingness to go along with the consensus to note the report, but probably some very specific and pointed continuing questions around some areas where we think that the mandate maybe isn't clear, and we do want to guard against Secretariat overreach, and we also want to guard against, again, their continuing work in a vacuum without kind of proper oversight and coordination with other key players. In this case, often that means WTO and WIPO, depending on the topic at hand. So that's part of that. With respect to the Italian resolution on transparency, just to say again, I mean, obviously that negotiation is ongoing. In fact, just today, right now, possibly as we're speaking, they're negotiating on that. Our colleagues in Geneva are negotiating on that in informals that Italy and the other sponsors have convened. I think, again, without being able to go into so much detail because it's an ongoing negotiation, we are appreciative of certain aspects of that topic that, especially, I should say, really, bottom line is we're appreciative of Italy raising the issue of price transparency, and we think that's very timely. We think that the WHO convening role through things like the Fair Pricing Forum that just took place in Johannesburg maybe a month or a couple months back, we think that those are good things, and that it's an important role that WHO can play as the convener, as the universal convener on these types of issues. And we think that the price transparency issue is incredibly timely as everyone is grappling with the high price of medicines around the world.
Great, thanks. I have another question about private sector engagement and how much you might see that changing under Tedros's leadership.
Mm-hmm. Yeah, so I think on the one hand we have the I guess infamous FENSA and how to implement that in an effective way, and I think to be honest, they're still struggling with that. As one of the negotiators of that, I understand it's a complex, often annoying document, but I think it does actually still provide a very strong roadmap for how WHO could effectively engage with the private sector in meaningful, positive ways from top to bottom in terms of the organization. So I still continue to have hope that they can get that right, and I have seen some signs of that with the transformation, that they're putting energy now not only into sort of internal watchdog roles, making sure that people aren't engaging inappropriately, but they're also putting energy now into promoting engagement where that engagement makes sense. And one good example of this that I think the colleagues will have probably seen, at the Tedros level, folks probably saw him tweet out, I think it was just last week, that he met with a number of the CEOs of a number of the big multinational corporations on the food and beverage side, and announcing that those companies had agreed collectively to follow WHO's metrics and timelines for elimination of all trans fats by 2023. And so we certainly here highly support that kind of engagement, and we think that, of course, in all of these cases, regulation has its place, but that there's a lot that can be done through collaborative work, so we hope that that those types of things will only increase in the future under Dr. Tedros's leadership. He certainly continues to lead the way, I think, in the right way. And if I could just expand my answer a little bit more, I was able to be one of our delegates representing us to this partner dialogue or partner forum or partner dialogue that Tedros and the Swedish government hosted in Stockholm last month, I think it was now. And that was a whole discussion on partnerships and on, of course, funding the transformation and where things would go. And someone asked, I think it was actually Seth Berkley, in a panel one of the evenings, what was the one thing, if you could have one thing you wanted for WHO, what would it be? And his answer was that for everyone in the organization to engage in a partnership way, in the same way that Tedros engages in partnerships. And I think I couldn't say it any better than that. That's what we need, is that vision that he has to be translated all the way down through the organization.
Thank you. Switching gears a little bit and thinking about the Global Action Plan on the SDG 3, just wanted to get a sense of your enthusiasm and confidence in that process and any recommendations or position for the 12 organizations leading that initiative.
Yeah.
This question continues, it can be seen both as promising or too ambitious.
Yeah. No, I think that's fair. So I don't know. I think I would definitely lean toward the too ambitious, to be honest, right now at this time. When it was rolled out, if I'm not mistaken, last fall at the World Health Summit in Berlin, we were cautiously optimistic at that time because what we saw it as primarily was a potentially effective vehicle to kind of harmonize and align the global health actors in a meaningful way toward achieving, towards achieving SDG 3. And given that, frankly, as a taxpayer and as donors into all of those organizations, like that, all of them basically should be working effectively together, without needing an action plan to do that, right? So on the one hand, we were like, well, that would be great if you all do that. You should be doing it anyway, but it's great if you can do it. Unfortunately, what we've seen as this has gone along is that it's expanded into beyond that kind of harmonization and alignment of actions and activities, into almost sort of policy generating space, because there is, I think, as I understand it anyway, there is an expectation that member states will need to execute many or most of the things that they're talking about for any of it to be successful. And the reality is, on a number of these issues, member states have either not taken a decision on some of those topics that they're including in this SDG 3 action plan, or they have actually considered some of those proposals and rejected them in favor of other ones. So we do have some concerns, to be honest, on the process and where it's going. I would hope that it could still achieve that harmonization and alignment objective. That to us is still a fundamentally useful and important objective for achieving SDG 3. But I think it's lost its way somewhat, to be honest. And I think it's treading into waters that are going to create more problems for member states and for themselves, and create more noise in the system instead of unity and focus on the tasks at hand. So that's where my worry about it right now.
Well, thank you for sharing that insight. I do want to be cognizant of the time and the fact that you have spent a lot of time with us today. We did have several other questions, but I think a few of us on the GHC team will follow up with individuals separately. I did have one other question about the full WH delegation list, and that, just to let people know, that is available on the WHA website, or the WHA website, but it's usually only a few days before the meeting starts. So just keep checking the website. And then also a question about whether or not the USG delegation will hold briefings in Geneva. GHC and some of our partner organizations are trying to set up those briefings. So Colin, if you haven't heard from us yet, you probably will.
Okay.
And we hope that we might be able to meet with you in person. I know it's really hectic during the week, but even if it's a 20-minute conversation, we hope that might be possible. Mm-hmm. Did you have any other last-minute comments that you'd like to share with the group?
No, I think that's I think we've covered all the main topics. I really appreciate everyone's time and interest, and definitely if they're very happy to do everything possible to have those touch bases on the ground as well. They're really valuable for us too when we can make them happen. So very happy to do that.
Well, great. Thank you. And I'm going to turn it over to my colleague, Liz, for some final comments.
Great. Thanks so much, Danielle. And also thank you so much, Colin, to you and your team, and for waking up early on a Friday morning and tuning into our webinar series. I know we at GHC and also our delegates and members really appreciate your time this morning. And again, I want to thank everyone on the webinar for attending this webinar, as well as the other webinars in this Pre-WHA series. And I do encourage, for those that are following or will continue to track WHA on the ground and also from afar, I do encourage you to sign up for GHC's WHA listserv. We send out some daily alerts just to let people know what's going on the ground, and to share any intelligence that our members and delegates have been gathering. And all that information is available on our website, www.globalhealth.org/World Health Assembly, and you can sign up for the listserv there. In addition, we do have a new WHA delegate webinar, sort of an orientation for new GHC-WHA delegates, which will be taking place next Wednesday, May 15th at 11 a.m. I do encourage, or For those that are joining GHC's delegation for the first time, this is a mandatory webinar that we ask you attend. We do share some important information regarding our delegation's policies and activities that week. For those that are just interested or maybe attending WHA for the first time or maybe the second time but still want some additional information, you can sign up for that webinar as well. We'll be sharing, again, this PowerPoint presentation and links afterwards. So if you want to review those links at that time, feel free to do so. And with that, I think we'll go ahead and then close out the webinar, give you a few minutes back to your Friday. Thanks again, everyone, for joining us today.
Thanks, everyone.